Hello and welcome to this edition of Ask the Service Provider. I'm Clem Harrod and I'm here with a close friend and health advisor, Jessica Barnhill. Jessica, thank you for joining us. Thank you for having this conversation. Thank you for always being a part of what we're doing here at Clemco and Clemco HR and helping to build this platform for independent contractors and people wanting insurance. You know.
Very happy to be here, Clem, and always happy to help your people.
Yeah. We're in the middle of a shoot right now, but I wanted you to come in and kind of see how we operate, what we do. You've always supported us, but haven't had an opportunity to be on a site, right, on a set. And I wanted you to just have another way to connect and understand who we are as independent contractors in the live event production industry, but kind of just overall wanted people to also see you and have an opportunity to build that connection with you. So thank you for joining us again.
Yeah, happy to be here, and it's great to be in person, so I appreciate it.
Yeah. People are often dealing with health insurance and trying to purchase health insurance, and there are nuances that can be scary. Just the information, the amount of information. One of the things that I wanted to talk about today, and I wrote a couple of questions, and one of those being, how do you, as a health insurance advisor, help someone feel comfortable with the idea of health insurance and finding something that's suitable for their wants and their needs?
Okay, well, any computer system, any health insurance agent can generate quotes based off two things: zip code and date of birth. Very easy. What I do that makes me a little different is I ask a lot of questions when I'm first introduced to someone. I ask about their past medical history. I ask about how often they go to a doctor in a year's time. Do they see specialists? How often do they see them? Prescription medication, what do they take? Is it expensive? And I ask them what's the three most important things about health insurance for them. Is it monthly cost? Is it out-of-pocket expenses throughout the year? Because depending on who you're talking to, there's different pain points. And what I've discovered too is what someone really wants is not necessarily what they need. So it's my job, after gathering information, asking questions and listening, to determine what the best options are available and to be able to explain to them what they are, how they work, and answer questions so that that person can make an educated decision.
Right. Well, okay. That's a lot of questions.
It is.
That's a lot of questions. And when speaking to someone about their health insurance and those needs, there has to be a level of trust. There's a level of intimacy in that engagement, in that conversation. So I know you, right, through years of interactions, but how do you help someone who you're speaking to for the first time, maybe the second time on the phone, open up to you like that?
That's a great question, and I establish trust with someone immediately. So the first time I speak to someone on the phone, I know it sounds unbelievable, but people connect with me, and people know right away and understand that I'm a safe place. I'm someone that they can share their fears, their concerns, and speak openly to me about things that they wouldn't normally share with someone else. Everything that's discussed with me is 100% confidential. I do abide by all HIPAA laws, PHI laws, which is public health information, and the conversation is very personal. So I have to be a safe place, and that relationship has to be known the first time I contact someone. And it's something that can grow and develop over time. But I am here for the customer. I'm not here for the insurance company. I'm here for the customer to find what's best for them. So the more that they tell me, the better I can help them.
That's an interesting point. So the more they tell you, the more you can help. I don't know if that's the same type of a situation that individuals who are working for an employer have, right? If your employer provides certain programs that someone can sign into, like you really are going through extra effort to know your people, to build that trust, build that relationship. So how do individuals, independent contractors, know that this is something that is affordable for the individual without going through that large employer group or something like that?
Okay, so there's more health insurance plans available than most people realize. So if your employer plan is not a good fit, or if your employer doesn't offer health insurance, or you're self-employed and you don't have an employer, there's a lot of choices out there. And affordability can come down to discounts that you might qualify for based off income that you make per year. It can be discounts based off good health. And it's also something that you can cater and customize for an individual for their specific needs. Maybe someone doesn't need the benefits that one household has, and one person travels, the other person doesn't. One person needs maternity coverage, the other person doesn't. So there's a lot of ways that we can make it uniquely fit someone. It's not a one size fits all. And when I speak with people, I hear often, well, I haven't heard those quotes before, or that's lower than what someone told me years ago. Or I talked to an agent last week and that's not the numbers that they told me. And I have access to more plans than most agents do. So that's what makes it better for me able to do a thorough research and look to see what's really out there for what can protect somebody.
Well, I mean, that's definitely eye-opening, to know that health insurance isn't just for the select few who have jobs, employers type situation, like the independent contractor, the individual, the freelancer, the gig worker, can also be covered,
Absolutely. Health insurance is extremely important, and it's not just for people that are wealthy or for people that are given employer benefits. Health insurance is something that every person deserves to have, and it's something that every American person needs to have. And it's a contract between a customer and a health insurance company. It's a financial agreement, which means if you have medical bills, those costs are not coming out of your bank account. You're not going to have to hand over your hard-earned dollars. The health insurance company is going to pay that bill. There might be a portion that you have to pay, but if it's something that's extremely expensive, you need to have financial protection that you don't have to cover those costs. So health insurance is something that you have to protect yourself, to protect your family, and also to protect your business, your income, your car, your house. It's about protection.
Yeah.
And sometimes it's about the what if and the what might happen, and maybe nothing will happen. But if something happens, you need to have the health insurance to already be there. And this way, when you're busy and you're working, if you get sick, if you're injured, you've got peace of mind that you don't have to cover that bill. You've got the health insurance company to have your back. And that's important for everyone.
That's huge. That sounds
me, everyone.
Yeah. Wow. Thank you. That's great. I want to take some time and kind of walk you around and introduce you to a couple of people. So thanks for stopping by. I appreciate that.
Yeah, you're welcome.
Yeah. So.
All right.
Again, thank you so much for tuning into this episode of Ask the Service Provider. Please understand that we're here to help you project the best image possible.